Scotland. You're listening to Good Morning Scotland. It is now 24 minutes to 8. So today is the much-touted Freedom Day for England. Most COVID restrictions are lifted, people can go to nightclubs, face coverings are optional, and social distancing rules end. The rules in Scotland are relaxed from today, but to a much lesser extent. Pubs and restaurants can open until midnight, but limits on outdoor meetings remain. The return of workers to offices will be delayed, and face coverings remain mandatory. Let's speak to Dr. Deepti Gurdasani, who is a clinical epidemiologist at Queen Mary University in London. Good morning to you.
Good morning.
It's somewhat ironic that so-called Freedom Day in England also means the Prime Minister and the Chancellor in self-isolation.
Yes, it is ironic. And you know, it really shows you the cost of letting a pandemic rage on. And at this point in time, you know, we've had loads of children off schools, our entire health workforce devastated by absences, and many other frontline workers affected, because that is the cost of letting an unmitigated pandemic spread. You can't have a normal life if you have a raging pandemic in the background.
Can you have freedom?
No, I mean, I think Freedom Day is really not going to mean Freedom Day for most of us, because I think the public are very cautious about this. In fact, most of our public wanted to continue wearing masks after the 19th of July. And I think, you know, clinically vulnerable people and people who have now been asked to shield, paradoxically, after Freedom Day, will be really, really conscious about going out now that mandates for masks on transport and in shops have been removed. It's very hard for them to go around their world safely in the midst of, you know, 1 in 90 of our population being infected.
We heard a little earlier from one nightclub in Leeds. Many nightclubs apparently opened at midnight in England for the first time in 16 months. They were advised by the government to allow people in if they'd been double vaccinated, to check their status or if they had a negative test. Certainly the nightclub that we heard from, the owner there said that he didn't bother because it wasn't mandatory. How concerned are you about this huge mixing in one go, as it were, in England?
I mean, I'm very, very concerned about it. And, you know, you don't even have to look at hypotheticals. You know, they had similar festivals happen in the Netherlands with large gatherings like this, where thousands of people got infected, and they were actually outdoors. So, you know, having lots of people mixing indoors, screaming, shouting, dancing with each other, no social distancing, no mask, is a really bad idea. I mean, we've got 18 months of experience from a pandemic to tell us that. And, you know, let's remember, infection rates are extremely high right now. So 1 in 90 people in our population have infection, much higher in the younger age groups. You know, in those age groups is as high as, you know, 1 in 50 or 1 in 30. And having those people mix in a super spreader environment is going to lead to massive surges of infection. I mean, the government knows this. They've been told that there will be millions of infections in the coming weeks. They've been told that our hospitals will struggle with up to 2,000 admissions per day. It's just that they don't care.
Well, at the moment, we're seeing somewhere in the region of 50,000 infections a day. Here in Scotland, the numbers are coming down, having been high previously. They're rising, as you say, hugely in England. 2,000 a day later in the summer is one of the estimates. The government say, and it seems to be backed up by their advisors, that ultimately this is now the time to do this because you cannot do it later in the year when schools go back and when the weather isn't as good.
Yes, I mean, that's a false argument. That's an argument that, for example, doesn't consider vaccinating adolescents at all. So if you consider that argument and you are not willing to put mitigations in school to make it safer in autumn, then, and if you don't look at the impact of long COVID, then it might appear that getting millions of children infected now ahead of winter so they develop naturally acquired immunity reduces the impact on adults in winter. But that's really looking at two very, very bad options, saying accept mass infection now or mass death in winter. And neither of those are real options, because in reality, rather than infecting millions of children with the impacts on long COVID, which the government has never considered, we could be vaccinating them in the coming weeks. We could be making our schools safer by introducing masks and ventilation schools so that we don't see the same surges in September like we've seen before. We could be giving boosters to people who are vulnerable with waning immunity over the winter later to protect them. All of those things could be done, but we've been presented with two false options, being asked to choose either mass infection now or mass death later, and that's completely wrong, and we mustn't accept it.
We found out from the figures yesterday a third of Londoners haven't had a first vaccination dose. We also found out yesterday almost a third of younger adults in Scotland are still unvaccinated, despite all over 18s being offered a first dose vaccine appointment by the end of yesterday. Do you think that there is a moment where enough people would have been vaccinated for us to potentially think about being more relaxed about the restrictions?
Yes, but I think it can't just be vaccination. I mean, unfortunately, we've imported the Delta variant, and the Delta variant has significant escape against vaccines. So while we get good protection against severe disease, things like infection and transmission still continue to occur. And that's important when you want to reach, the herd immunity threshold. So even with 100% of our population vaccinated, including all children, which of course is not going to happen anytime soon, given they're not even eligible and uptake won't be 100%, we will still have outbreaks. So we need to think long term, which is investment in ventilation in shops, workplaces, and classrooms. These are things that are not restrictive, but make a huge difference to a virus that's transmitted through aerosol transmission. And, it's very, very clear that even vaccinating 70% of the population is not going to end outbreaks. So we need to really be honest with the public about this and put in the other measures we need alongside vaccination to contain spread. And then we can open up.
The Vaccines Minister, Nadeem Sahawi, is doing some interviews this morning. He says the JCVI has recommended only vulnerable children aged 12 to 15 should be vaccinated, as well as those 3 months short of their 18th birthday. He's going to make a statement to Parliament later today. So it looks as though there isn't any mass vaccination planned for those children in that age group. Is that a disappointment to you?
But it's not just a disappointment. I'm terrified for our children. I mean, the way we are going actually requires children to get infected and develop immunity via infection, which is herd immunity via infection, rather than get vaccinated, because we have people in our leadership who have practiced exceptionalism compared to almost all of the world. Almost every country in the world is now vaccinating adolescents at pace, including in Israel, that's recently had an outbreak with higher levels of vaccination than us. More than 6 million children in the US alone have been vaccinated. But we've decided that it's safer to expose children to a virus that causes long COVID, with 9,000 of our children already having had long COVID for more than a year, rather than offer them a vaccination. I mean, I cannot tell you how reckless, unethical, and crazy that is.
We talked at the beginning about self-isolation in the context of the Prime Minister and the Chancellor of the Exchequer. We know that self-isolation is causing kind of problems in terms of health service, and we're now being told that businesses may have to work shorter hours just because of the sheer numbers, especially if we get to 2,000 infections a day later in the summer. There's a suggestion that in the health service in England, for instance, depending on how much pressure in certain departments there are, if someone is double jabbed and is pinged, they may be able to do this thing of testing daily rather than actually self-isolating. Is that a good idea, that self-isolation in some instances, if people are vaccinated, can be dispensed with?
So I think, first of all, let's be clear. The problem is not self-isolation. Self-isolation is a recognized and necessary measure to keep people from infecting others if they are at risk. The problem is infection, and self-isolation is a smoke alarm. Infection is a fire. What we've done is we've seen a burning fire, and we've decided not to deal with that, but to switch off the smoke alarms. And that's what we're doing, which is only going to make the fire worse, because keeping people who are double jabbed in work when they've been exposed to a virus, and we know that with the Delta variant, people get infected and transmit, indeed, quite frequently, particularly healthcare workers who will come into contact with vulnerable individuals with comorbidities in the healthcare force will come into contact with them. And this will essentially put even more people at risk and make our transmission even worse. But the government's mantra is that transmission doesn't matter because of vaccination, but it does, because we already have 1 million people in our population living with long COVID. Our healthcare force has been decimated and they're already struggling. But our government is actually making this worse by, once again, not dealing with the root cause of the problem, which is unmitigated transmission, but trying to ask people not to isolate when they've been exposed to a pathogen that can cause deadly disease and severe chronic illness in many people.
Here in Scotland, of course, as I mentioned in the introduction, things are different. Although we are at level 0 now, there are mitigations in place, limits on outdoor meetings, the return of people to offices is delayed, face coverings remain mandatory. Is that cautious approach justified?
I think it's completely justified. I mean, I would have probably gone more cautious than they have. But, I mean, it makes absolutely no sense to kind of remove mass social distancing at this point in time. And we need limits on large gatherings where super spreading events have occurred, even in London and Wembley. So I'm really glad that Scotland and Wales have decided to take a different approach to England. I think England should serve as a cautionary tale to pretty much all parts of the world at this point in time, because I don't think there's any country that's gone ahead and done what they have in terms of endangering their own public.
Thank you very much for speaking to us this morning. Dr. Deepti Gurdasani, clinical epidemiologist at Queen Mary University in London.
13 minutes to 8 now. The news.